The following program is an exclusive presentation of the Young Foundational Health Center. If you or someone close to you is suffering with type 2 diabetes, I urge you to join us. In the next few minutes, your life or the life of that someone close to you will change. I'm your host, Bill Thompson. From the Young Foundational Health Center, here is my interview with Dr. John Young. Dr. Young, thanks so much for being with us today. There is so much news out there about type 2 diabetes where it's virtually an epidemic. It's affecting the young, the old, and everyone in between, and the side effects and the results are just devastating. Can anything be done to help stop or reverse type 2 diabetes?
There's plenty that can be done. In fact, the information's been out there for 80, 90 years. It's basic physiology and biochemistry. And what we're finding in my practice is that we're stopping, the ravages of diabetes. We're getting 80% of our patients off all or most all their medications within about 8 to 12 weeks. And the thing is that one of the worst aspects of diabetes for a lot of my patients is this neuropathy, where they get this numbness, this burning in their hands, their feet, whatever. Doctors have told them, here, you're going to be on these drugs just to kind of keep the pain level down. We're finding that as we get to the root of the problem, as we deal with insulin resistance, most of these people improve dramatically within about 6 to 8 weeks. So you can do something, and it's not just treating a symptom, it's getting to the root of the problem.
When you get to the root of the problem, and you mentioned this has been around for 80, 90 years, I'm confused here. Why is this around, and what is this information that doctors and people are not paying attention to? What is this about?
Well, it's first year medical school. It's basic biochemistry and physiology, the things you learn in the first 2 years of medical school. And then what happens is you pass the test, you throw the book away, forget about it, and you go out and you practice so-called real medicine, 3rd and 4th years, your residency and so on, where you're learning how to use the drugs. The problem with the drugs is this. You're just treating a symptom, and especially with diabetes. The main symptom that we're treating is elevated blood sugar. But diabetes is a multi-system disease. It affects the brain, it affects the nerves, it affects the heart, the kidneys, the pancreas. Basically every organ in the system, diabetes affects. And we're just treating one aspect of it, which is an elevated blood sugar. We're forgetting all the rest. And basically, it's just what the textbooks have said for 80, 90 years. Here's what's going on in this disease, and if you want to get to the root of the problem, you're going to have to do these things. So it's not just, there's probably 10, 20 symptoms of diabetes, and we choose one, which is elevated blood sugar. I say, that's fine. If you're happy with just having that one symptom treated, that's fine. But most of my patients come in because they want to get to the root of the problem, they want to get over their disease, they want to get better, get off their drugs.
Now, on your site, I had read about your desire to help reset the pancreas and work with the cell, and your use of the Dr. Young Ultimate Power Shake. Can you tell me, start with me about this resetting the pancreas and the cell structure, and how the Power Shake is going to help that?
Well, if you look back at basic physiology and diabetes, what you realize is the problem is insulin resistance. We're producing too much insulin to drive glucose or blood sugar into the cell. And as the patients, continue to go about their daily lifestyle, they take in more and more carbohydrates, which become glucose, and you have to produce more and more insulin to get the job done. So the whole problem is, what are you going to do to reset these insulin receptors so you don't need so much yelling, you might say. In other words, with our kids, I'll say, Christian, go to bed. He won't do it. So I'll yell louder and louder and louder until he finally does it. And the same thing with diabetes, is we find that we're having to produce more and more insulin just to get the job done. You need to reset those receptors. They sit in the artery, you reset them. And the easiest way to do it is with a protein that has not been heated over 130 degrees. And that is very, very important. And in our shake, the Young Ultimate Shake, that's what we've done, is we've taken a protein that's not been heated over 130 degrees. All the immunoglobulins, all the lactoferritins, all the key things are there. And that's how you begin to reset a pancreas.
So what is the Young Ultimate Power Shake? Tell me about what that is and what that's going to do for me, and how long is it going to take for it to work?
Well, the shake is basically the protein. If you take in a lot of protein, you develop a lot of free fatty acids. So we use something called AB, or acid base, because if you don't deal with acid with a diabetic, you're going to end up with diabetic ketoacidosis. So you have to deal with that. That's very important. And then we, in some of the shakes, we'll use an oil. And we use 3 parts flax, 1 part fish oil, because we're also trying to remake a cell membrane, really reduce the inflammatory aspects of diabetes. You put it together as an emulsion, and we'll have the patients do that maybe 2-3 times a day. We make some adjustments because I need about 1 gram of protein for every 2 pounds of body weight. And I hit that pretty hard for the first 4 to 6 weeks.
1 pound of protein.
1 gram of
1 gram of protein for each pound of body weight.
1 gram protein for every 2 pounds of body weight.
2 pounds of body. So I weigh 180.
So divide by 2.
90.
90. You need about 90 grams of protein a day.
Of quality protein.
Quality protein. And, you know, you can also get that protein from vegetarian sources if you're not into eggs or fish or chicken, things like that. But most of my patients still are short. And so I need to get those levels up because I'm trying to reset some receptors. And I will hit it pretty hard, or they will hit it pretty hard. And here's what's amazing. Whether they're on insulin, in fact, I had a fellow on 300 units of insulin a day, and his blood sugars were still out of control. Within 3 days, he was down to 75 units of insulin. Within 3 days.
It's amazing.
But what I find is for most of my patients, within about 7 to 14 days, I'm starting to cut their medications in half, starting to cut back. And that really encourages them. So they're like, all right, I see some progress coming on here. And the idea is it takes about 8 to 12 weeks to reset those receptors. So I'm shooting for within 8 to 12 weeks, have them off most all or all their medications if at all possible.
So they add the Ultimate Power Shake to their diet for 8 to 12 weeks.
Right.
First question on that. What happens after the 8 to 12 week? Do they continue? Do they have to continue?
What I do is I tell them this. All right. And you can do this with blood tests. We get a fasting insulin level, not a fasting glucose. Insulin. We want to measure insulin. Exactly what the Center for Disease Control has said for years, that doctors need to measure fasting insulin levels, and very few doctors do that. But once you get them set and get them off their medications, I say this. If you're going to continue to live on planet Earth, you need about 1 gram of protein for every 2 pounds of body weight. You know, give or take a little bit. I have patients, they go to Disney World for the weekend with their grandkids. It's carbohydrate city. All right, they come home and maybe for 2 days they'll have a shake, maybe twice a day for a couple days. Because the idea is over the long haul, over the weeks, months, they need to be pretty much like with you, close to 75, 90 grams of protein a day. You do that, and you're probably not going to have trouble with diabetes. It's like this. If I kind of keep gas in the gas tank, the car's going to run. I don't have to fill it up every day. But if I just keep enough gas in the gas tank, the car's going to run. If I can just get enough protein, deal with the acid base problems with protein, this patient's going to do quite well.
During the 8 to 12 week period, what additional dietary and or exercise steps do I need to consider?
Really, it'd be nice if they would walk, but it is not dependent on whether they walk or not. I have patients that are in wheelchairs, they're bedridden, they can't walk. It is nice, it just makes things move a little bit better, but I can do it without it.
So you're recommending a little bit of walking. What about diet? Do I need to change my diet?
Temporarily, we want to change the diet. And I tell patients it's like a broken leg. I have patients, I've got to run every day. You break your leg, you're going to have that leg in a cast for 8 to 12 weeks. No running. Take the cast off, you can run. I'm going to put a cast, you might say, on your pancreas. And for about 8 to 12 weeks, there are certain things that I want you to really cut back on, stay off of, if at all possible. No corn, carrots, beets, peas, Brussels sprouts, no white potatoes, no rice of any type, no grains, cereals, pastas, fruit juices, alcohol, cane syrup, high fructose corn syrup, molasses, honey, things like that, because they all become sugar in the body very quickly. I don't want the pancreas to produce a lot of insulin real fast. I like them to eat, sweet potatoes, broccoli, spinach, cauliflower, things like that, where you release their glucose or sugar load slowly over the hour. No quick releases. Slowly is fine. And that helps reset that pancreas.
What about meats, red meats, fish, good, bad, shellfish, and also dairy?
I don't have problems with the fish, the shellfish, the red meat, the chickens, the turkeys, the dairy. Love eggs. But what I'm trying to do is I'm trying to get half their body weight in protein every day. Now, they can be a little expensive doing that, and that's why we developed the Young Ultimate Shake, because each shake is about 25, 30 grams of protein. And I know for a lot of my patients, what does breakfast consist? Some coffee and a piece of toast, on the run. Well, the shake takes about 45 seconds to make. There's 25, 30 grams of protein. So at least I've got something in them to start the day. I may have them do another one before they go to bed or put it in a thermos, take it to work. But I like food. I want them to use as much food as possible. I just find that for most of them, it's very hard to get that amount of protein in, and this is where the shake really makes a huge difference.
Well, one of the things I must tell you that you haven't brought up is the taste of the shake. It really tastes great. Now, bear in mind, I am a diabetic. Bear in mind, I had problems with neuropathy. Those things have totally disappeared. And it's like I've 30, 40 years off. I'm 63 years old. I feel like I'm in my 20s.
It's interesting because I always make a shake for my patients. I say, well, what did the other doctors make for you? Well, they don't make me anything. Well, here, I'm going to make you something to eat. And they see me make it, and especially when I say it's 3 parts flax, 1 part fish oil. They see me pouring it in there. They're like, oh, this is not going to be good. Okay. And I'll make it for them. And there's a lot of recipes, and we give that to the patients. And you know what? They're always like, ooh, this is quite good. Can I finish it? Sure. Once they see how to make it, listen, I want people to be successful. You can have the greatest cure in the world, but if people can't stomach it, it doesn't do anything.
If for any reason you're unable to listen to this life-saving interview, you can go online to www.youngfoundationalhealth.com. That's www.youngfoundationalhealth.com. Or call Young Foundational Health Center at 727-545-4600. 727-545-4600. That's 727-545-4600. Are other doctors adapting your protocol?
They're starting to. Because really, and I think this is patient-driven. At first, we tried to get other doctors to do this, and they're like, no, Young, you're an idiot. This is the way the drug companies have told us to do it. We're going to do it this way for the rest of our lives. But now I think patients really, in today's society, are demanding changes. They've been doing the drugs, the pills, the injections for years. They're getting worse. They're getting more and more medications. They want to get off their medicines. They want to feel better. One of the things that I didn't realize until later in life, as I was talking to my diabetics, is a lot of these diabetics are on medications that make them just feel lousy. I remember when she came in and she's on 5 different medicines for her diabetes. And I'm like, oh man, this is going to be a tough case. And then as we're going through the interview, she just says, now listen, John, I need to be perfectly honest with you. I haven't taken those medicines in like 5 weeks. I feel great. If I'm going to die, at least I'm going to die feeling great. I just can't do it anymore. Patients are basically telling the doctors, we want to get off our meds, get to the root of the problem. Don't treat any more symptoms.
You understand that many type 2 diabetics will find all of this difficult to believe. What's your message to these skeptics?
Well, what I say is, why'd you go to the doctor in the first place? You went to the doctor because you were diagnosed with diabetes. You wanted to get better. All right. All he's doing is basically slowing the progress of the disease. And now new studies are coming out and saying it may not be slowing it, it may actually be worsening the disease.
What's the message to your skeptics?
You need to realize that we want to get to the root of a problem and not treat a symptom. And the only way I know of you can do it is you have to go back to basic biochemistry, physiology. It's first year medical school textbook medicine. If you're happy with just having symptoms treated and watching toes get amputated, feet amputated, kidneys start to fail, eyes start to go blind, then stick with what you're doing. But if you really want to get better, I think you're going to have to go back to the basics, and that's what we've done.
You understand that many type 2 diabetic sufferers will find all this information difficult to believe. What message do you want to relate to your skeptics?
One is I want to tell them that patients are being tired of just having their symptoms treated. They want to get to the root of the problem. Number two is I think a lot of doctors are afraid because what are the other doctors going to think about them? And I had to say, is it more important that I have a good reputation among my peers, or do I get patients better? And the other thing is, when you start doing this, it really becomes fun. Medicine actually becomes fun. So I say to my skeptics, you want to enjoy medicine again, you want to really make a difference, you want to get people better, is you're going to have to start thinking differently about a number of these diseases. And with diabetes, you need to think about getting to the root of it. And boy, are you going to end up with some happy patients.
I want to thank you so much for being with us today and helping our audience by giving them this information, this wonderful, amazing information about how they can really start to do something about their diabetes. Thanks so much for being with us today.
Thanks for having me.
18 years ago, when I was 45, I was diagnosed with type 2 diabetes. Last year, when I was 62, neuropathy began to set in, and they say that's the first sign. My vision was not what it used to be. Someone told me about Dr. Young, and he simply looked at what I was doing, got me off my prescription, put me on the Ultimate Power Shake. And in 6 weeks, my blood sugar is back to normal. My neuropathy is all but disappeared. My vision is coming back.
Well, I met Dr. Young through our church, actually, and known him for about 5 years. As a consequence of that, we have had many conversations over the years relative to medical practice, procedures, treatments, diagnoses, things of that nature, and that's how we met. Knowing that John was a medical doctor, I have known some medical doctors who have been involved in what would be called alternative medicine. Perhaps most medical doctors would consider alternative medicine to be outside the realm of orthodoxy. Since I know him to be a man of integrity, I know him to be a man of honesty, that he would not be doing something just simply for the process or simply for the purpose of earning money. And that impresses me. And consequently, it drew me to the point of doing research on my own. And as a consequence of that, I believed that he's right. People in my clinic have been helped, and I personally have been helped by using the products and the methods and the procedures that Dr. Young has suggested by virtue of the fact that I have patients who I have had for many years, who I have tried to get their weight controlled, their diabetes controlled, blood pressure, cholesterols and triglycerides controlled, and truly have not been successful doing that using standard protocols. I have had people who I have started on the processes myself with the products, and I'm finding that for the first time I'm getting their weight down, I'm getting their blood pressures down, their blood sugar levels are coming into normal levels, their cholesterols are down. They're excited for the first time instead of being disappointed by their inability to get control of their life in many ways. I also have personal experience with it. I tell people frequently over the years when it comes to weight loss and weight control that whenever I find a dietary process that is appropriate and safe, I will use it and I will recommend it. And I've not done that before. Well, I think the thing that has made a significant impact on me with regard to my own personal level of pain, as well as the fact that I have testimonials from people in my clinic also who are explaining the very same things to me that is occurring to them. My goal in the clinic is to actually accomplish the same thing that John has accomplished with regard to removing or getting people to be able to remove or to lessen the amount of medications that they take. I'm really not familiar or aware of any downside to it at all. I have found it to be useful in people with a variety of issues, whether it's controlling weight, whether it is improving their bodies with regard to sugar control and getting their pancreas to work better, or whether it's a reduction of cholesterols, or whether it's a reduction of blood pressure. You know, people have a tendency to be skeptical.
You are listening to groundbreaking medical information from the Young Foundational Health Center in Largo, Florida. Dr. John Young is giving you the information you need to help you or someone you care about to end the suffering and side effects of type 2 diabetes. If you're like most of the Young Foundational Health Center's patients, their licensed medical doctors may very well help you get back to a completely normal life and to end your dependency on prescriptions. Regardless of how advanced your type 2 diabetes may be, even if you're suffering with neuropathy, you may be able to reverse these ailments. I urge you to call Dr. John Young at the Young Foundational Health Center as soon as possible. The Young Foundational Health Center's phone number is 727-545-4600, 727-545-4600, 727-545-4600. That's 727-545-4600. Or you can go online to www.youngfoundationalhealth.com, www.youngfoundationalhealth.com. All major medical insurance coverages are approved. Start living your life again by calling the Young Foundational Health Center at 727-545-4600. The preceding program was an exclusive presentation of the Young Foundational Health Center. If you or someone close to you is suffering with type 2 diabetes, I urge you to contact the Young Foundational Health Center. You may no longer have to live with type 2 diabetes. If for any reason you're unable to listen to this entire life-saving interview, you can go online to www.youngfoundationalhealth.com. That's www.youngfoundationalhealth.com, or call Young Foundational Health Center at 727-545-4600, 727-545-4600. That's 727-545-4600. For the Young Foundational Health Center, this is Bill Thompson. In addition to Young Foundational Health's work in the area of diabetes, the doctors and staff also work with patients suffering from heart disease, hypertension, COPD, clinical depression, and many cancers. Dr. Young's philosophy is based on getting his patients well rather than just prescribing another pill. Many of Young Foundational Health's protocols call for all natural, no drug, and non-invasive procedures. Dr. Young will help your body keep you well and help keep you off side effect-laden prescription drugs wherever possible. Dr. Young is a licensed medical doctor, an MD, who has been in practice for years. At Young Foundational Health Center, you're a real person. Dr. Young knows his patients by their names. Your care and well-being is of the utmost importance to Dr. Young and every member of the Foundation staff. All major health insurance coverages are accepted. You can experience the personal care at Young Foundational Health Center by calling in Largo, Florida, 727-545-4600, 727-545-4600. That's 727-545-4600, or online at youngfoundationalhealth.com. That's www.youngfoundationalhealth.com. We look forward to meeting you and getting you healthy and keeping you at your healthiest best.